Hey guys, welcome back to STEMPOWER. My name is Simran Singh.
And my name is Ria Patel. Joining us today is epidemiologist Cynthia Carr from Epi Research.
Okay, so now for some background for our listeners, Cynthia Carr is an epidemiologist, as previously mentioned, a health policy specialist, evaluator, community engagement facilitator, and a strategic planner. She started her work in the Northwest Territories with Epi Research, where her primary focus is on the Indigenous, Northern, and rural equity and the overall access to health services.
So for today's episode, Cynthia is going to be busting some of the crazy myths you guys have been hearing about the COVID-19 pandemic. Aside from that, you'll also be hearing about all the research and work Cynthia does for the Indigenous people in Canada and their healthcare systems, as well as her interests, and just she'll give us a better idea of how everything's going on currently in the COVID-19 pandemic and how it came to be and what the government is doing to limit the spread. So once again, welcome. Do you want to add anything to that little intro about your work, or?
Just a tiny little correction. I started my career in the Nunavik in the Northwest Territories. I actually worked for the government of the Northwest Territories straight out of graduate school. I went to Queen's University and went from there to Nunavik. And then in Yellowknife, I also worked for the government in the Northwest Territories. And then I worked for Manitoba Health. And then I started my company in about 2000. So I've had Epi Research for just over 20 years now.
Well, congratulations on your 20-year anniversary.
Thank you.
Okay, so I guess to start us off today, we'll ask you, what inspired you to follow this line of work and become an epidemiologist?
Well, it's really interesting. And I want to say to all young people, if you're in grade 12 or even first year university or college and feeling that pressure that you need to know now what it is that you want to be in the future, I say this to my daughter who's in her first year at Queen's and my son who's in university and also pursuing hockey. Don't worry at 17, 18, 19 years old about knowing what your answer is in terms of your career path. Chances are you won't know, and that makes sense. How could you possibly know what you want to do? Go in an environment where you feel comfortable, where you will thrive, and then you will see as you go. Maybe you thought you wanted to be a doctor, maybe you thought you wanted to be a lawyer, and what you thought is actually what you will continue to pursue. But you might not. So my example is, when I was a teenager, I thought I wanted to be a speech language pathologist. So I did all kinds of research about what do I need to do to get into grad school. I did an undergrad degree in psychology at Queen's. Every course I took was so that I could get into grad school in speech language pathology. Then suddenly in fourth year university, I heard of this program called the Masters of Public Admin in specializing in health policy. And I thought, maybe I want to work more globally. Maybe I want to work more at a national level, making change as opposed to a one-to-one level with clients. So I did a master's in public admin and health policy. And as a part of that, I had to take intro to epidemiology. I literally, after 5 years now in university, never heard of epidemiology. So I took the intro course, I fell in love with it, and I thought, if I want to be involved in health policy, how will I actually understand what I'm talking about? I want to learn more about how to understand research, how to understand data. So I did a Master of Science in Community Health and Epidemiology, and that sort of took me into my future. As I said, I started the Northwest Territories, and for young people too, dare to dream. Go far. You can always come back to Ottawa, to Toronto, to Kingston, to Edmonton, wherever you are. Go into an isolated or northern environment. You will get experience beyond anything you could ever imagine at a very young age. And then you can bring that experience back with you if you feel like you want to be in a larger center. So just be open to new ideas, be open to new experience, and don't put so much pressure on yourselves right now to know all the answers.
Wow.
That's really interesting and eye-opening.
That's very inspirational as well for all of our young listeners.
I'm glad.
Yeah, so I guess adding on to what you mentioned about Epi Research, so what's the philosophy of your company and what is it that you guys want to accomplish?
So our goal is to help our clients have a voice and to plan health programming that is sustainable and based on evidence. So when we talk about having a voice, we want to help our clients, whether it's a First Nations community or it's the government of Manitoba, understand who is your target population? What are their health needs? How can you best meet their health needs? So just having a building does not mean that somebody's health need is being met or that healthcare services are accessible. They have to be the right services. They have to be culturally appropriate. They have to be affordable. They have to be sustainable. We work a lot in the social determinants of health approach, which is looking at well-being broadly. So the health system is one aspect, but there's all kinds of other things that impact our health. And we're learning now firsthand during the pandemic, our income, our stress, our ability to manage our mental health, our education levels, our housing, our food security. All of those things matter to our long-term health outcomes. So we work in a broad way with our clients, as I said, to have their voices heard, to develop programs that can be implemented to meet the needs of the community members.
That's amazing. It's really crazy and well, not crazy, but it's just amazing about like everything that you're doing. And this next question actually ties in really well with what you started talking about. So, can you just explain a little bit or just talk about the differences that you've seen in terms of healthcare for the Indigenous people and just the overall difference in the accessibility to healthcare in different parts of Canada?
Definitely. So one thing that's you can always look at if you're interested in, if I was just going to look at one indicator of healthcare access, if you can get hold of it, what you want to look at is people who are using the emergency department 2-3 times a year. When you look at populations in northern Canada or rural areas, an indicator that they don't have ongoing continuous access to primary health care, which could be a nurse practitioner or a doctor, but ongoing care that meets their needs, that they feel comfortable with, is if there's excessive emergency department use, because that will show you that they're not having their needs met. They might be using that emergency department just as you would for a doctor, but it also may indicate that people aren't managing their health well and they end up in the emergency department quite sick. So when we look at northern and rural health, we'll see higher rates of use of medical travel, of emergency department use, and there's very different models of care. Often in small communities, there isn't a large health center, there aren't inpatient hospital beds, so often it's also very challenging to recruit and retain healthcare workers to stay in the community. So our northern communities often have to look at different models of care, of contracting services. So there's always new people coming into the community, which can be a challenge. The doctor won't know who the person is. The person won't know the doctor. And then there's that challenge of repeating your medical history over and over and over again. And all of those things matter to our health. So certainly there's different models of care in our northern communities. And then, as I said, with that, the impact of social determinants of health. If you don't have access to healthy food, you don't have access to resources to help you manage your stress, you might turn to smoking or drinking or other things that impact your health in terms of trying to manage your stress. So there's a myriad of factors that impact our northern and Indigenous communities that certainly result in more people with chronic disease and higher rates of early death and higher rates of death due to injury. And some of those, unfortunately, are self-inflicted.
What you said about the ER room, that's really important because especially right now during COVID-19, we're getting a lot of like information from news outlets about hospitalization and ICU cases. So these spikes that we see in some large centers like maybe Ottawa or Edmonton, like you mentioned, will probably be drastically different from the ones in rural communities. They might have more ICU admission, correct?
They could if they don't get care in time, and if they're more likely to have underlying conditions. So if they're living with diabetes or heart disease, other conditions that we know COVID makes worse. So for example, the Center for Disease Control published research that they had done showing that 16%, so almost 1 in 5 people that have died of COVID also had diabetes. Also high rates of death amongst people that have hypertension or other heart conditions. So which shows if you're already living in a situation where your health is not optimal, you haven't been able to control it, you might not get as quick access to healthcare, you could be one of those ones, unfortunately, that even if you're not elderly, you end up with the worst health outcomes by virtue of all of those things working against you.
Ria and I have seen you engage a lot in the media recently on CTV, Global News, and CBC, where you discuss COVID-19 and just shared information with the public about the virus. So, my next question for you is actually from one of our listeners, and it's just turning everything more to the COVID aspect, I guess you could call it. So, what's the main difference between the seasonal flu and the novel coronavirus?
They're two totally different viruses. The seasonal flu is a virus called influenza, and then COVID-19 is a coronavirus. So this is the seventh coronavirus. There's four that cause about 1 in 4 common colds. There's SARS that you may have heard of that caused a significant amount of mortality, but thank goodness it seemed to be more of a fragile virus and it burned itself out. And then there's MERS, which is in the Middle East, which is still existing, but thank goodness it doesn't transport as well between people. So it has stayed in an environment and not traveled throughout the world. So influenza, we know there's many different strains of influenza, but both are viruses. The difference is that influenza, we have found, research has found vaccines. Unfortunately, they don't last long because influenza is really good at mutating and changing every year. So we have to have a seasonal flu shot to try to predict what the strain will be. But there is success with that, and there are antiviral drugs. Coronavirus, even though this is the seventh version, it has, so corona, remember, means crown. It has that ball shape with the spikes around it, the spike proteins. It's been really challenging for researchers to understand what it is, how to get on top of that spike protein part of it for our immune system to be able to understand and react properly, which is exactly what the vaccine is helping us do, right? Vaccine is not a treatment, it's a coach, like a coach of a team. And if your team has a bunch of injured players or they're not talking or they're not communicating, you're not going to be as effective. So that's why, again, this virus has been challenging and impacting older people more because their immune systems don't work as well. It doesn't react as quickly to protect the body. So they're two totally different viruses. What they have in common is they do, the more dangerous versions or strains come from animals. So it started in an animal and then animal to human transmission and now human to human. And that always makes it more challenging to get on top of because all that we're doing right now as humans, we can't control what's happening in the animal population. So if people are eating or consuming or coming in contact with wild animals that might have either one strain of the influenza or the coronavirus, that's how it gets really dangerous and can transmit into our human population. So we need to stay away from those foods sources that are not going through our safe food handling processes because wild animals can have these strains of viruses that unfortunately can get into humans.
Okay. Yeah, that's really interesting. That's a good point. That's a good comparison between the influenza and the coronavirus. So the next question we have is also from one of our listeners, and we may have to take a different spin on it from what I just heard from you. So how do you feel about doctors, especially recently, claiming that the seasonal flu is in fact more deadly than the novel coronavirus? I'm not sure what our listeners' background on this is, but what are your thoughts on that comparison?
Certainly both do cause death. What we're learning about coronavirus is at the beginning, the symptoms seem the same, like your respiratory system, your lungs seem to be most impacted. What we're learning more about the coronavirus, unfortunately, but we are learning, is that it impacts all areas of your body, your heart, your circulatory system, taking your blood from your head to your toes. And that's why we're seeing even more people at risk of very poor health outcomes that have diabetes or heart conditions, others than just your standard during the flu season where those matter, but you're more concerned about people that have existing respiratory conditions. So certainly we are seeing that the impact is more serious with coronavirus. What's different and what we're still trying to understand is that difference with kids. So influenza seems to be the most serious in people under the age of 5 and seniors. And the best spreaders tend to be young people, like young, under 10, and seniors. The people that end up in the hospital the most with influenza are 5 and under and seniors. Coronavirus, for whatever reason, doesn't appear to impact our young population in the same way as influenza does. And yet it's mostly transmitted from respiratory droplets. So what is it about young people that seems to have some safety measures against coronavirus that they don't have for influenza? And again, trying to understand the science of the disease, that pathway into the body, from those protein spikes into what's called ACE2 receptors. Is it that younger people just don't have those receptors as well developed, which is protective, which means that it's not allowing that spike protein to get into the cells and then start replicating. But certainly both are dangerous, and definitely right now we're seeing higher rates of mortality due to coronavirus than influenza.
Okay, so I have a little question based on the point that you brought up previously about SARS. So, um, I believe it was an epidemic and it was an outbreak in Canada, I believe in 2003. I'm not sure what year it was, but I'm pretty sure it was in that year. What are the main differences that you've seen in terms of what the government has done for the two coronaviruses? I believe, as you mentioned, that SARS like falls into the subcategory of one of them. So was SARS, I read somewhere that SARS was more deadly than this SARS-CoV-2, as they're calling this coronavirus. So how has the government done like different things right now than they did during SARS to help the population more?
Well, the government has had a challenge. The difference with SARS, which, as you said, we haven't seen since 2003-4, when there was an outbreak around the world, it had a high mortality rate, about 10%. The difference was that its symptoms came on much faster and they were much more obvious. So with SARS, government and health system were very immediately alerted something new and really dangerous is occurring right now. The difference with the COVID-2, as you say, which the second SARS, which we're calling COVID-19 now, is that subtle symptoms. You know, you can get infected. It can be 5, 6, 7, 10 days before you show any symptoms at all. But this virus has that great way. It can still spread when you're asymptomatic. It took longer for government to understand that this is something new and serious than it did for SARS. What we've tried to learn, though, from SARS is the importance of immediate, as soon as you find out, that immediate communication. We've identified there's a problem, here's what we need to do, and to be open and honest from a government level and to get your resources in place. One thing that came out of SARS too was the importance of equipping long-term care homes the same way that acute care homes were, with protective equipment. Fortunately, that didn't seem to happen across Canada from that. The other learning from SARS, unfortunately, that we didn't jump on globally was the importance of eliminating wet markets. So SARS also was that animal to human transmission, appears to have come from what's called a wet market, which is where you would go to a market, there's live animals, they're being slaughtered on site. So the material from the animal is literally around, it gets on humans who might touch something else. And one of the biggest learnings from SARS was the communication, equipping long-term care homes, and getting rid of wet markets. We didn't. And this also appears to have been another opportunity coming from a wet market of wild animal to human transmission.
When you mentioned like the 3 things that need to be done, so I've also been hearing a lot about how, I know this sounds completely unrelated, but climate change, how overall the temperature of the world is getting hotter and hotter. And from what I hear, heat tends to breed these kind of viruses more. Is that the case? And would we be seeing more epidemics and pandemics as the world gets hotter?
Well, different viruses and bacteria thrive in different environments. So this virus actually likes cooler, more drier temperatures to thrive. So, it's hard to say. There's, like I said, the different viruses will thrive in different environments. The impact, obviously, of crowding, more and more population density, it makes viruses or bacteria easier to transmit between people. But we can't say that global warming impacts everything the same way, but it certainly will have an effect on viruses and bacteria that like to grow in that environment. And of course, different areas of the world where safe water is already a challenge, the more warmth there is, the more need there is for clean and safe water, and that challenges our health as well.
Yeah, that makes a lot of more sense. So I've been hearing on the news and just from different people saying that, oh, COVID spikes they're just going to spike all up right now because in Canada, especially and in colder climates, because, the snow is coming, the temperature is dropping. So I believe from what I've been hearing and from what you've said, it's all just starting to make sense now. And I think most of us, at least from my end, have some form of a COVID alert app on our cell phones. So, how important is it for people to have this COVID alert application, at least in Canada, on their cell phones?
So those things go together. So as risk will continue to increase, unfortunately, as the weather gets colder, because we know that we'll have less chance for natural ventilation like we did in the summer with our doors open, our windows open, being outside. We know that this virus likes recirculated air. It likes people to be together indoors for longer periods of time so that it can transmit. We also know from research that transmission within households is common and it's quick, and over half of that is asymptomatic. So there's lots of risk as the longer we are indoors together. The beauty of the COVID Alert app is that your privacy is protected. You enter no data at all into it. You have it on your phone, and instead of contact tracers trying to keep up with more and more cases and trying to alert people, you would have an opportunity. It's just another tool in your toolkit to let you know if you might have been in contact with somebody who self-identifies that they've been diagnosed with COVID-19. So nobody in the public health system is going to take your information and enter it onto the app. It's up to you to download that app on your phone if you want. It follows where you are, and it uses Bluetooth technology to say, how close does it appear you were from the strength of signals to somebody else, and for how long? So you won't get all these false alerts if you happen to be in a grocery store on the same day with somebody, but you were nowhere near them. It's literally your phones are pinging off each other, but it's nothing identifying about you. And then again, it would be up to you if you were diagnosed to go on yourself, enter that information, and then anybody who meets that, behind the scenes, I don't even understand it, logistics of how all the pinging works, that if you were identified as being close to that person for long enough, you would get an alert so that you can quickly isolate yourself from others in the household, monitor for symptoms, and get tested if you have any symptoms at all. So knowledge is power. Early intervention saves lives. And think about it, if you've got all kinds of other apps on your phone, this is no more intrusive than any other app, and in fact, maybe less so.
Yeah, that's a really good point, because I've been hearing a lot of people, like, it's a great new technology, this app with the Bluetooth and everything. I'm sure it's doing a lot for everyone who wants to do their part and like turn it on when they're outside and have that updated when they are positive for COVID. So it's a great innovation. So I'm going to add another question that ties in pretty well with the one that Simran asked. So do you believe that social media is creating the wrong image in people's heads about the virus? So as in where people should go for the right information and where not to get misinformed?
Definitely. So if you have to look really, really hard for some new piece of information, unless it's in a peer-reviewed medical journal and there's a new study coming out of the Lancet or the British Journal of Medicine, New England Journal of Medicine, names that you would know or that you could look into. If it's something embedded within a tweet or Facebook or Instagram, and there's no other real source, or it's a very vague friend of a friend, or somebody said, or it comes with a heading, what government doesn't want you to know, the secrets government doesn't want you to know. Take a beat, use your critical thinking skills. And critical thinking isn't attacking and being negative. Critical thinking is literally looking at something and going, what are reasons for me to perhaps think that that might not be the case, or what can I go and look at to reality check this before I press share and I send that to all kinds of other people. This kind of misinformation with social media, it starts with a very small group of people. And you wonder, like, what the heck are you doing all day that you have time to be on social media going on and on and on about these theories and ideas that nobody else has ever heard of? Like, if you know that much, how is it possible you have time to be on social media? Wouldn't you be in a lab or in a hospital, or government has hired you to be part of the solution? So I can even tell you, I have my own Facebook, and then I have Cynthia Carr, epidemiologist. I don't even look at that anymore. I post my information. People will come into my Facebook and embedded within a post will like spend hours talking back and forth to each other, embedded in Cynthia Carr, epidemiologist. Like, if you really got good information, why are you embedding this crazy conversation back and forth within somebody's Facebook? And how do you have time? And the things that are said about threatening me physically, calling me names, calling my daughter names when she posted about having the COVID alert app. And then with that, these crazy theories about, a vaccine will kill you, or this will kill you, that will kill you. Nobody knows this, but really? Nobody knows this, but you know this. Why wouldn't government want us to know and be as informed as possible when without a vaccine or a treatment, we are the solution? We have to be empowered and educated and ready to act. So government is not hiding things from us.
Yeah, I 100% agree. I'll always be going through social media and just seeing people posting false information, and just, I don't even know what to do at that point. I just try and ignore it and
Ignore it.
yeah, yeah. So I think we're almost reaching the end. So we're just going to throw in a few more additional questions. So this next one is from another listener, and they were asking, is the 14-day quarantine enough after being exposed to the virus? Does this number mean something in particular, or was it just randomly chosen?
It wasn't randomly chosen. So I referenced a little bit about this virus's strategy. It's called an incubation period. So the incubation period is the time between that you were infected and the time that you get symptoms. And it can be as long as 14 days. Now we're starting to hear more and more 10 days because we want to look at when you could be most infectious. So you might hear a change now to 10 days. For example, with influenza, that incubation period is short, like 48 hours between being infected and feeling sick, you know it. So that 14 days is literally saying the time between being infected and trying to be as certain as possible that you're not going to develop symptoms, that you won't be infectious. That's what that 2-week period is. And that's why if a new rule comes in, like to say we have these restrictions, people say, how come the next day the cases didn't go down? Always remember, cases diagnosed today are related to infection that actually could have occurred up to 2 weeks ago, and just finding out about it now. That's why this virus, it really has been able to spread and thrive so well.
Yeah, that's a really thorough explanation. Thank you for that. I'm sure it's going to clear up the views of some of our listeners. So as we slowly reach the end of this episode, we want to end it off with a few personal questions. So the first one is, what was the proudest moment or greatest achievement throughout your career so far?
Well, other than being a mom, proudest moment in my career, I think when I work with communities to identify need for services and we actually get the money and we see them implemented. So right now I'm working with a group in Kenya to develop a clinic called the Fighters of HIV and AIDS, meant to empower young women. And to see that go from proposal to government funded to actually being up and running during a pandemic with all of the challenges we've had, I'm very proud of that and very hopeful for all of the young girls and women that will be able to access that center. And I love that they called it Fighters. We're not victims. We're fighters of HIV and AIDS, and we're going to work together to be healthy.
I love how you brought up that, about women and just, ensuring that everyone has proper access to everything. And I just love how you're working towards, making that even bigger. So we are reaching the very end, and I have one last question for you. Do you have any advice or words of wisdom, as I'd say, for our listeners just at home?
Well, I think I started out with lots of advice that you didn't ask for. That's the mom and me. But really, look at your role models and remember no matter how old you are or how young you are a role model to somebody else, whether it's your friends, your peers, younger brother, sister, cousins, kids you babysit. You are a role model. Every time you make a good decision, somebody's probably watching you, and you might not even realize that you impacted them. Just like if you're having a bad day, you see something on social media and you send it out there, you could actually be hurting somebody else that you've never met. So remember how you look up to people, that other people look up to you, and that includes your friends. And when people make decisions, it's usually if you ask them, what do your closest 5 friends do? If your closest 5 friends smoke, you're likely to smoke. If your closest 5 friends are very athletic, you're likely to be athletic too. So just remember, in your group, you're a role model, and nobody knows all the answers. And it's okay to be stressed and a little bit scared right now. We all are. It's been going on for a long time. Young people have had so many things in your lives impacted, and I am so impressed and proud of the resilience that I see in so many of you.
Oh, that's very nice of you. Thank you very much, Cynthia. So that was
You're
definitely
welcome.
great advice that I'll keep with me, and I'm sure Simran will, and our listeners will benefit from them as well.
Yeah, I totally agree with Ria on that one. Thank you so much again,
You're welcome.
Cynthia, for this opportunity to speak with you. It was a very, very delightful experience, and I learned a lot. So thank you so much for that.
You're welcome. Take care.
Okay, so thank you, Cynthia, and thank you all for listening to this episode of STEM Power with epidemiologist Cynthia Carr. We hope you stay tuned for the next one.